Listen, I came over to talk to you. Obviously, what stimulated the call was the announcement of the recent grant awards, which is an annual thing for your organization.
Right.
I know that you've been doing that for a long time, but one of the reasons I wanted to come is because Cahaba Medical Care obviously is an organization that people oftentimes living here in Bibb County, people take for granted what we have here in Bibb County and don't really know what goes on behind the doors of this brick and mortar building sitting over here.
Yes.
On I think that's Belcher Street.
That's right.
Yeah. Belcher Street and Bibb Medical Center on the corner of the campus. I moved back to Bibb County after living away from here for a long time in 2005, and when I did, your office was right over there, a couple of 100 yards away.
That's right.
And it was a small rural medical practice. And I noticed from your annual report that back at that time you had about 10 or 11 employees.
That's right.
And I noticed from your annual report from last year that you have over 500 employees. So something has happened.
Something's happened in the last 10
Something
years.
has happened in the last 10 or 15 years of significance. And I don't think that people in the day-to-day walk of life here in Bibb County, a lot of people haven't noticed that or don't know how far your reach has extended beyond the corner of Bibb Medical Center's campus. So I want to talk about that a little bit today.
Okay, thanks.
And give you an opportunity to talk about it. I want you to talk about it, not me. But I just wanted to set the stage for why I'm here.
Okay.
Obviously, I want to talk about the work that you do, but I would like to highlight for Bibb County folks what your practice here really means to this county. And if we could just talk a little bit about how you got, if you would talk about how you got from 2010 or 2012, I think, I noticed from the announcement that you were first designated as a teaching health center back in 2013. And that's an accomplishment in itself. So would you give us a little background on how you went from a rural single practitioner clinic to a teaching healthcare facility on the campus of Bibb Medical Center? How did that happen?
Sure. I'll try to make it as succinct as possible too, because you might imagine there's 15, 19 years of stories. Back in 2010, Dr. Lacey Smith joined the old practice, so we became two physicians at that time. So Dr. Lacey Smith is a physician that lives here in Bibb County as well. She's been with me since that time, and we, from July 19th, 2004, when I opened that clinic, I told Terry Smith in 2003 that I was moving to town, moving my family to town, and I wanted to. My parents taught me to leave something better than when you found it. In 2004, when we opened, we never turned anybody away because they couldn't pay. By 2010, we were paying the bills. I think we were doing good medical care, but the one piece that we felt like was missing is that there was still need just in this community, and it wasn't scaling. Just one tangible example would be like a social worker or adding an RN to an outpatient practice. And so Dr. Lacey Smith and I found this grant, and this one is not the Teaching Health Center grant. This was the Community Health Center program. So we, in 2010, turned the organization, or really we created Cahaba Medical Care Foundation. We created a parallel company that was a nonprofit, and we wrote a grant, and we didn't get it. In 2011, we did not get it. In 2012, we got a call from the federal government, and they said, you guys scored a 95 on your grant. We funded a 96 and above last year. There's some extra money been put in this year's appropriations. We're gonna pull the 95s in. So we became, it was just in June of 2012, we became a community health center, and that meant we had annual line item grant funding to help defray the cost of the uninsured population that were already coming to Cahaba Medical Care. So we then resolved the Cahaba Medical Care PC, the organization that we ran as a rural health clinic for about 8 years, and that folded into Cahaba Medical Care Foundation. So the community hopefully didn't notice, because that was our goal, is to just keep seeing patients in the waiting room and just start growing the number of people. So that was 2012, and I live here in Centreville, have for 19 years, and our focus, no matter how much we've grown in the community, and I'll talk about that in a second, we've always wanted every single community, and Centreville in particular as our first clinic, to just be really relevant to the community and serve the community. The last 4 years, according to federal data website at data.hrsa.gov and UDS Mapper, 100% of the low-income population for the last 4 years here have had affordable access to primary care, and it really has been a good partnership with the hospital, because we've been able to cover each other's flanks in terms of us recruiting in new physicians and especially trainees, and them being a good training site, and everybody sees how the hospital has grown in this area as well. And I think it just speaks to what can happen synergistically when a hospital and a medical practice work together. But I think you want me to talk about the teaching health center too. So
exactly,
yeah.
and what that means in terms of bringing not only medical care here, but bringing personnel here.
That's right.
And intellectual property. I use those terms.
Sure.
Doctors probably don't use that term, but you're bringing people to Bibb County who are going to learn about Bibb County and hopefully help the economic development of Bibb County, which is meaningful.
That's right. That's right.
So how did you? What inspired you to begin wanting to do that and bring personnel here for their internship or their fellowship or all of those things?
Right. Well, I've always wanted to teach, as well as be a doctor, just kind of a doctor, teacher. That's kind of been this dual goal. So if you kind of look at the dual mission of Cahaba, we've got kind of both of those things in our mission statement. And, people may or may not know, because it was a very small footprint, but back in 2008 in the old practice, we got accredited. I was teaching at the University of Alabama, and we got accredited the state's first rural training track. At this point, it was under the University of Alabama umbrella. In 2011, there was a dean change at the University of Alabama, and they sunset that program. They said, we're not going to...
The rural health program.
Rural training track in Bibb County. It wasn't the rural medical program. It wasn't John Wheat's program and the rural medical program at Tuscaloosa. That still happens.
Okay.
But that rural track got sunset. So Lacey and I were looking at a sunset program, and that Tuscaloosa's last resident left in 2013, and we were looking at the program. We still want to teach. We had been talking with Joseph Marchant about having an expanded teaching program. At that time, we had 2 residents per year coming down from Tuscaloosa. And Dr. Smith and I said, well, we need to figure out how to do this on our own. So even before we got this community health center clinical grant for the uninsured, we found something called a teaching health center program. Now, there's a lot of bad press, especially in this part of the country, about the Affordable Care Act. Some people, call it Obamacare. But one of the things that the American Academy of Family Physicians, that John Meggs has been a part of, they spent about 20 years advocating to the federal government, we need more training doctors out in our communities.
Right.
Well, you know how stuff gets tucked into legislation. Well, we were Section 5506 or 5508, I forget, in that legislation, and it created an opportunity for a community to create a teaching program for doctors that's not at a big university, not at a big university hospital, but in a community. So we wrote a grant. It was a dual grant. We had to get accredited and funded, but we did that in 2013. Created the Cahaba Family Medicine Residency. We carry the same accreditation in graduate medical education as, say, as a UAB residency might. And we started bringing 4 residents per year in July of 2013. And in this, Bibb Medical Center is our key partner, because that's the hospital these guys rotate at.
Right.
And so it was 4 residents per year. It's now 5 residents per year. So there's 15 licensed physicians in their apprenticeship that live in Bibb County. And then, of course, in addition to me and Lacey, we've brought in other faculty members that come. Some live here. You know, many people know Dr. Jamie Bishop, Dr. Christine Whiten, and others spend a day or two a week here. So, you know, if you look around, there's some 20 physicians here just as a part of this dual clinical and teaching program.
Right. So, and I read in your forecast that by 2024 you'll have a total of 60 resident physicians here. Is that a good number?
That's right. Now, not all of those are for Bibb County. So when we get to 2018, then we started doing some other things. So that part of the story. So we've got 15 of those 60 are for Bibb County. So we've got 5 per year in a 3-year program. And that big ticket grant dollar that we get. So what people may not know about physician training is you got undergrad, you pay tuition. You got medical school, you pay tuition, you become a licensed physician, and then everybody's seen Grey's Anatomy or ER or whatever. Right. You got this apprenticeship where you're paid not as a physician, but you're paid as an apprentice,
right? And
you got to get board certified. So that funding has to come from somewhere. That funding is a different grant. It comes from the federal government, from the Department of Health and Human Services. And so as we've grown more residents in this pipeline of putting doctors in rural areas and underserved areas, that grant, it's a grant that pays their salary. But what this announcement was, we've got 4 family medicine residency tracks. One in Bibb County, that was our first, 2013. We have another one in the west end of Birmingham, right, called the Urban Track. They've got 7 residents per year. There are many, many neighborhoods in Birmingham that are underserved, as you might imagine. We opened a clinic there. We put a residency program there. It's been on me and Dr. Smith's heart to serve in the Black Belt. We've opened a clinic in Marion. We've merged into a clinic in Camden that we've taken over ownership and management of, and we wanted to put a training program there in Marion and Camden. So one of these new grants is for the Frontier program. They spend their first year in Bessemer at our clinic there at UAB Medical West, and then they go to J. Paul Jones Hospital in our Marion and Camden clinic. And then in maybe the most unique grant we've ever done, UAB School of Medicine, they closed their family medicine residency back in 1999. There was a big statewide strategic planning meeting with UAB, and Dr. John Meggs was actually on that strategic planning meeting, and they were just giving UAB advice about, they do so great at so many things, but what could they do that would be more relevant to the community? And they said, well, reopen your family medicine residency. UAB asked us to help them do that, and so we did that. So that started this July. Cahaba Medical Care helped UAB get their family medicine residency back. That's called the Highlands Tract.
Okay.
So that's a little snapshot.
Right. So I want to kind of review that again for people who are watching, because that was a lot of information.
Yeah.
So from Bibb County, or from your office right here, you're managing programs that serve a lot of counties. You got programs in Bibb County. You got programs that serve Perry County. You got programs that serve Wilcox County. You're in Jefferson County. And I also noticed on your website that you have programs that touch Hale and Dallas and Chilton County. How does that happen, Hale, Dallas, and Chilton? Is that out of Wilcox and Perry County?
That's right. Yeah, we have physical locations in. We have 22 clinics.
22 clinics.
22 clinics. Physical locations in Jefferson County, Bibb County, Perry County, Wilcox County, Chilton County.
Okay. And they're all managed from here, right?
That's right. Yeah, our administrative headquarters, we've got about, of the 550 employees, we've got 250 in Jefferson County, 250 in Bibb County. So we've got 254 employees in Bibb County. Our administrative headquarters for the whole organization is right here in Centreville.
Okay. Yeah. So the purpose for all of this, if I understand it, and correct me if I'm wrong, but what I get out of this is 2 things. You are serving a large population of people who probably couldn't get care otherwise if it weren't for
That's right.
the underserved population that you address.
That's the mission.
Okay.
That's right.
And number two, you're training people to serve in rural health care.
We want to teach people, we want to do it, and we want to teach people to do it. You know, that's the basic idea.
So I noticed, if these numbers are wrong, tell me if I'm wrong, but you got 39 alumni out of your last year's report. 26 of those are working, these are graduates, in underserved areas, 21 of them in Alabama. Is that right?
That's right.
And 8 of them are working in rural counties. I noticed that's way above the national average for people who go through a medical training program.
If you look at all-comer family medicine residencies, you get to the end of a career, only about 25%, only about 1/4 will go into an underserved area. Our data out of the Cahaba UAB Family Medicine Residency is 68% of our graduates are going into underserved care. If you look at all comers across the country, family medicine residencies, you're not going to believe this number, but 5% go into rural. Only 5% go into rural. Our number's around 30, I think it was 31% with this last graduating class, 31% go into rural. So it's more than 5 times the national average. So we love those numbers. That's what we're preaching. That's what we're teaching. That's what we're mentoring our guys to do, and they're doing it.
Well, I saw those numbers, and that's a remarkable record of placement and, I guess, commitment to rural health that you're putting into these guys who come through here. So they must like something.
And it's a return on investment. People, you see these grant dollars. Most of that passes for those resident salaries. Those resident physicians can't bill. That's how we pay them. But then once they land in these rural areas, the value that they bring of moving their family to the community for 2, 5, 20 years, and shopping in those towns, and this is how pipeline works. This is how it's supposed to be working. Is you bring them in for training, they love it, they stay, or they go to somewhere similar, and it's an economic engine.
Well, you also are running the obstetric clinic. Isn't that correct?
Right.
Here at the hospital, that's operated by Cahaba Medical Care.
It's nuanced. It is a joint venture. It's a joint venture with BIB. So they built the facility, and they manage that facility. I'll tell you what Cahaba's piece of the BIB Medical Center labor and delivery is.
Okay.
We're 100% of the physician staffing. So the four of us docs that deliver babies, do C-sections there. The BIB Medical Center doesn't have to worry about staffing that with physicians. We've brought the physicians. Cahaba Medical Care has brought the nurse anesthetists in. So a labor epidural, when we go to C-section, you need anesthesia. Cahaba does that. And then the nursing staff is a shared deal. So it's a BIB Medical Center leads the nursing. We provide 2 nurses to that pool. You've seen hospitals and labor and deliveries close all over the state over the last 10 to 20 years, and us leveraging. This is 2 other grants that Dr. Lacey Smith wrote to bring some of those personnel and plant them on the BIB Medical Center campus, and BIB has brought their own resources to bear. It really is a joint venture. We couldn't do it without each other, and it's been a fun partnership. We've grown a lot together, and 2016, I think, is when we started that.
Right.
Yeah.
Well, talking about that growth curve, I noticed the number of patients was another number that stuck out to me. 6,500 patients you saw in your clinic in 2012. Last year, your clinic served 159,000 patients. Is that right?
And that's not counting all the COVID drive-thrus.
Yeah, I saw 67,000 COVID tests administered by Cahaba Medical Care last year, and 42,000 vaccinations given.
That's right. Yeah, that's right. It's a few more at this point, but that's right.
That's a lot of vaccinations.
We really I know the pandemic exhausted everybody, and I know lots of us got crossways with each other, but at the core there was a virus that was causing problems for a lot of people, and we just wanted to be in all of our communities, we wanted to be a good community partner in terms of testing, vaccines, and a reliable source of information. And we try to do that with respect to everybody. So,
Well, Bibb County is a poor county, and I know you wouldn't want to brag about these numbers, but I want to mention these numbers that I saw in your report. Last year, Cahaba Medical Care provided uncompensated care for people who are uninsured or underinsured of over $7.8 million and filled over 31,000 prescriptions in your pharmacy at no cost to patients.
that's right.
That's a remarkable number. You also provided other investments in the community and support for people who needed help. So you're providing things for the community that are not limited to medical care and pharmaceutical care. So Cahaba Medical is doing a lot of things for our community. I don't think people know enough about that. So part of what we want to do is get that message out. I'm enthusiastic that you will be able to continue working with the funding sources that keep you floating and growing. Right. And we wish you the best for that. I know that in the last year that Cahaba Medical Care has acquired a piece of property over in this direction, right. 145 acres that is between the hospital and the ballpark for future growth plans. Can you tell us anything about what you might be planning?
I'd love to. Thanks for that. Yeah, thanks for that. I mentioned that of our 550 employees, 250 plus of them are in Bibb County, and I've now lived in Bibb County longer than I've lived anywhere else. 19 years, I've made it my home, and this is our first clinic, and this is our administrative headquarters. We've made the strategic decision, our board and our executive team, that we want to keep, it tosses around in our minds, should we move to Jefferson County? We want to keep our administrative home right here in Centreville. People, if people don't know whether we're on Belcher Street or on Hospital Drive or where we are, I mean, I know you don't know where our HR department is and where our billing department
That's
is.
right.
We're spread all over town.
You're everywhere. We can't keep up.
Yeah, we're all over town in little, we got 3 people here and 8 people here.
Right.
And, as we're recruiting more and more professionals to either make their career with us or move to Bibb County. We've got people that have moved into Bibb County. Our CFO moved into Bibb County and bought a house here. And we need an administrative building.
Yes, you do.
That's kind of respectful to professionals that are making their career here. We've got 50 to 60 people just on the admin side, and that number is going to grow as we open more clinics. So, the headquarters need to have more people. And so we've got some beautiful plans. I'd love to talk to you again when we get all the plans drawn up, but the basic outline of that property is we want to make some public green space that the community can use and that our employees can use too, but that we would make it kind of a Cahaba managed public green space, kind of like we've done with the school system and with Bibb Medical Center over on the Riverwalk and with the city.
Right.
We'll do some more of that. We might have an amphitheater or a pond or something up there, and then there'll be kind of a centralized space that will really be at the headquarters proper, a training center. When we get, if we just get 200 or 300 people together for some training, I mean, we have difficulty finding, where to sit everybody. So a training center there and just a headquarters for our administrative team. And then we have students of all flavors coming through. We have guest physicians coming and covering all the time. So we'll probably build a little residential suite for from the numerous trainers that kind of come to Bibb Medical Center under Cahaba's name, and another educational joint venture. Bibb's become a little bit of a rural mecca that we work on this together. So there'll be some spaces that'll be a little more private for people to stay, and
Great.
when they stay here for a month rotation or what have you. So that's the outline.
Obviously, we need more residential properties in Bibb County, and there are a lot of people who are trying to address that in different ways. And there are a lot of efforts being made to address economic development by other people in the county, and that's good news about the county. Mental health. Are you doing anything in the area of mental health? That's the only thing I didn't see in the things, the direct programs that you provide.
Absolutely.
Are you doing something there?
Absolutely.
Okay.
We have, we are, I try to go through the laundry list. We have over 20 social workers and counselors in the organization. It's one of the largest group of social workers and counselors of any nonprofit community health center in the state. Our approach is called integrated behavioral health, which means we really believe that, people have depression and anxiety and have, whether it's ADHD or PTSD or other things that happens just like you have heart disease or diabetes. And sometimes people just don't want to leave the comfort of their primary care doctor and have sometimes the stigma of going to a psychiatrist. So we've embedded a case manager, a behavioral health consultant, and a counselor in every one of our clinics, including our Centreville clinic. And we've got a psychiatrist and a psychologist that work for the organization part-time. We've gotten Alabama Department of Mental Health certification for substance abuse. We've got 30 of our physicians that provide substance abuse medication-assisted therapy. But at its core, the most traditional thing that we have is counseling appointments with our almost a dozen counselors around the organization, and the availability of psychiatry that comes once a week here.
Well, one of the things, good to see you.
Good to see you.
All right.